I'm David.
I'm Christine.
And today our presentation is on cardiac rehabilitation therapists and what it's all about. So the nature of a cardiac rehabilitation therapist, first off, it develops nutrition, exercise, and education programs to further advance wellness and strength for patients that have had heart surgery or have suffered some form of heart disease over their lifetime, so basically to get them back on track. It is also meant for patients who have had chronic heart failure or have underlying cardiac transplantation, things like that. The main purpose for cardiac rehabilitation is basically to prevent the disease from occurring again. So we don't want them to have to go through this traumatizing events again. Prevents like coronary events, subsequent hospitalization, and death from cardiac causes, which are very deathly in today's society. The program will be assigned for the patients that include prescribed exercise and interventions designed to modify coronary risk factors. And we basically came up with a video that kind of sums up what we just mentioned.
So here at St. Grace, our cardiac rehab, we have 3 phases. The first phase is where patients actually in the hospital, post-heart attack or post-heart surgery or post-stent. And we'll actually go to the patient's room and we'll see them and we'll give them education and we'll talk to them about cardiac rehab so they know what to expect when they get out of the hospital. Phase 2, patients will typically come to us. It's an outpatient program, and this is a program where patients will come about 3 days a week for 2 to 3 months, and they'll just come for about a 1-hour exercise session. We actually monitor the patient's heart while they exercise. We take their blood pressure, and the whole purpose of the rehab program is to strengthen the heart, reduces the risk of having future cardiac events, improves quality of life. Actually, studies
So that basically gives us like an overall view of what a cardiac rehabilitation therapist does, and it's very important for the elderly, obviously, in today's society. So what does it take to become one of these therapists? Well, first off, for education, a bachelor's degree is obviously required, whether it's in kinesiology, exercise science, or some kind of related field to that. This includes coursework in general sciences, along with introductory physiology, anatomy, and biology that can prepare for entry-level work in cardiac rehabilitation.
And for graduate programs, you can specialize in exercise, physiology, cardiac pathology, and primary prevention programs. And this degree offers and requires 36 credit hours and can also have internships. Certifications are also available to broaden career opportunities, which candidates must hold bachelor's degree and complete at least 400 hours of practical experience. One of the certification offered for this career would be the joining the professional certification for the American College of Sports and Medicine. Credentials offered are certified clinical exercise specialist, registered clinical exercise physiologist, which you can work within a professional sports team and research field. For the employment outlook, our research showed that there will be 28% growth expected in the year of 2016 to 2026 for physical therapists, and there will be 24% growth for occupational therapists. So you see from the map, the red color outlines the high rate of global availability of cardiac rehabilitation around the world. So especially that we're going through this coronavirus, we can see how healthcare services will increase in a couple years, and as well as the rehabilitation jobs around the world will also increase as well.
So the salaries of a cardiac rehabilitation therapist, I'd say, are pretty solid. The average annual pay for a cardiac rehab therapist who holds a bachelor's degree and obtained a professional certification from ACSM is around $58,399, so overall not too bad. Salary can also be as high as $109,000 a year. It can also be as low as $21,500 a year. Of course, this depends upon location, the amount of experience you have. So again, like obtaining the bachelor's degree, graduate degree, and that certification from ACSM is very critical. Recent findings show that cardiac rehabilitation specialists in the Tacoma area here in Washington make an average of $59,000 a year. So again, depending upon the location, the salaries can vary.
Yes. And here are some resources that